Hello, my name's Dr. Adam Thorne. I'm a dentist on Harley Street in London. My clinic is Harley Street Dental Studio. I have a team of specialists and multidisciplinary team of specialists and dentists here who work with me, providing the optimal care for our patients. Teeth become worn down in three ways. One is called attrition, which is where teeth rub against one another. One is by erosion, which is when we have acidic drinks. These may be acid drinks like fruit juices or carbonated drinks. And one is abrasion from wear, so if people brush their tooth too vigorously. We're seeing a lot more of the attrition type, which is when teeth rub against one another, with anxiety levels increasing. This is known as a term called bruxism. Our goal is to protect the teeth and stop them wearing down, so that we can keep the teeth looking good, but also functioning and healthy. Worn down teeth will continue to deteriorate if the factors that are causing the wear are not removed. So they may be, if you are grinding your teeth, a habit known as bruxism, then that habit either needs to be stopped or prevented. If it's due to erosion, which is acid or carbonated drinks, then we obviously need to look at the risk factors. Often this can be some improvements in diet, not necessarily changing the whole of your diet, but when you have these risk factors and what we do immediately after that. If it's due to abrasion, which is tooth wear from, say, vigorous toothbrushing, we will talk you through how to improve your brushing habits so that you're not causing any further damage. Worn down teeth can cause problems. Commonly, the patients usually come to us when they either have shorter looking teeth and they have been worn down from, say, grinding or bruxism. They may come to us because the teeth are getting a little bit thinner. This can give a translucency to the tips of them. That's often common when people have more acidic diet, say fruit juices or carbonated drinks, or sometimes some acid reflux. Or they may come because they have little grooves on the teeth from tooth wear, from brushing the teeth too hard. Unfortunately, worn down teeth don't always regenerate themselves. There's no treatment out there that can do this. That may change in the future with stem cell technology, but at the moment, we have to prevent any further damage and then look at replacing what damage has been done. They require treatment, obviously, to prevent the cause of damage. This can be if people grind their teeth, then we may put something in there to prevent that, something known as a splint. If it's due to acid erosion, where the teeth become a little bit thinner, then we'll obviously go through diet and risk factors and what you do after having something acidic. Or it may be that you're causing damage by external factors such as toothbrushing, in which case we'll educate you on how to improve your brushing so you're not causing damage to the teeth. The treatments available for worn down teeth are as follows. It depends on the cause. Now, if someone grinds their teeth and has tooth wear, usually on the tips of the teeth, this is known as attrition, and it may be that they have a habit called bruxism, where they grind their teeth. Usually we will look at creating what's known as a splint, which is a hard bite guard that is worn over one of the jaws, either the upper or the lower teeth. This prevents any further damage being done and gives the patient freedom to move so they don't necessarily grind their teeth so much. Once that is controlled, we can then look at building the teeth up. This may be either something known as bonding, where we add tooth-colored filling material to the teeth to build up to their former glory, or we can replace them with something known as a ceramic, which may be porcelain, veneers, or crowns. These have a slightly better finish than the bonding, are more durable, but can be a little bit more expensive. If it's due to something known as abrasion because of heavy toothbrushing, then obviously we will see the damage that is done remove the cause by educating the patient on how to improve their toothbrushing, and then see how much needs to be restored, whether it can be some small bonding as above or by placing ceramics. Same for a habit known as erosion. Now, this may be due to acid drinks, it may be due to acid regurgitation, or it could be due to things such as fizzy or carbonated drinks. Again, we improve the dietary factors that are causing this and look at the amount of damage that's done and whether we restore it with bonding or ceramics.